Hey, good morning. This is Stacey, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio, joined, of course, by my partner in crime, Dr. Dana Hawkinson, Hawkeye, Doc Hawk. Hey, we are really happy to be back with you today. It's so exciting to be here to be able to deliver good news about things that are going on. And I want to make a special shout out this morning to our very first COVID-19 vaccination person. This is Marianne Copeland, one of our own respiratory therapists. She said she did it for her family, friends, coworkers, and community. I've known Marianne for a while because we do a lot of work in CF and we work with respiratory therapy a lot. So Marianne, thank you for being number one here at KU. We so appreciate the message that helps send to everyone in our community. What a big deal. Vaccinations are here, Hawkeye.
Yeah.
That's exciting.
Wow, it is exciting. And this is for the Pfizer vaccine that has been approved. And it's really exciting. And, you know, even last night, you know, was taking time reading the FDA brief for the Moderna. So there will be a meeting for that soon. Hopefully they will find that it is safe and effective, and it absolutely does look safe and effective, and that will be EUA approved as well. And that will just increase our supplies in the nation to get those vaccines to people.
Indeed. And, you know, I know that the last time when the FDA sort of gave their preliminary endorsement, even before they held their hearings, that was sort of the sign that, you're going to get green light. They've done that for Moderna as well, so really expecting that to happen. But in the meantime, we still have a lot of COVID to wrestle with. How are we doing today?
You know, we're doing good. We are on the downtrend this past week, which is a very good thing.
That is a good thing.
76 acute patients in the hospital, which is better from mid-80s yesterday. 36 of those in the ICU and 26 are on the vent. So still a large proportion on the vent, but overall our numbers of acute infections are down. We still have 74 in the hospital otherwise, so it's about 150 total COVID patients here. Hays is doing better as well. They have 26 total patients, with 19 of those acute and 5 in that recovery period. So hopefully we can continue to see that downtrend of hospitalizations and ICU use.
Wouldn't that be great?
That's great.
You know, so on our chief medical officer call yesterday, we have that call once or twice every week, and I will say that everybody's numbers are down a little, and we like that. We even had a little ICU bed capacity, so that made us feel a little better.
Yeah, just think if you combine masking, distancing, not gathering in large groups, either in public or in private homes, and the vaccine, how quickly we can get back to some semblance of normalcy.
Yeah, that would be so good. Remember yesterday we described the vaccination, and really the monoclonal antibody therapy I think should be up there with that. That's going on the offensive against coronavirus, man. That's good treatment, good prevention. That's awesome. In the meantime, you still play great defense. Offense and defense goes together to win a game, and the defense is the pillars of infection control. They do keep you safe, just as they've kept our staff safe, taking care of COVID-19 patients every day, cohorting those people on a ward. Our staff stay safe by following the rules, wearing a mask, washing hands. I mean, it really does work. Great offense, great defense. We can beat the coronavirus.
Yeah.
I'm pretty excited about that. Hey, let's see if there are reporter questions out there this morning.
Good morning, guys. Taylor Hemnitz from Channel 41. How are you?
Hi, Taylor. Good.
A couple of questions about the vaccine, obviously, in regards to hospital care. And I'm going to ask them both at once so you guys can tackle them both at once. One, when patients are admitted to the hospital now moving forward for something other than COVID, will they be given the vaccine as part of their treatment if that fits into the schedule when the vaccine is available and that kind of thing? And two, just overall for, obviously that's been a big thing for patients with things other than COVID and availability for them this year. How does the vaccine being given to frontline workers and hospital employees change, if at all, what patients for something other than COVID can expect when they come to the hospital now?
Okay, so let's stick on that first part about whether or not, Dana, we're going to be giving that vaccine to patients as part of the routine discharge. And just to say we do that with pneumococcus and we do that with other vaccines as part of your admission, we're going to come and ask you, do you want this vaccination? I don't think we have a supply yet for COVID-19 to do that, though I would foresee the day when that does happen.
Yeah, I think that's a great point. We already have active screening. That means nursing and physicians asking questions to patients about pneumonia vaccine or pneumococcal vaccine, but also influenza. That's an active screening process we've done for years here. And just in the last couple of weeks, we've actually discussed trying to have that active screening for the COVID-19 vaccines when they are available. So there is that process that we are already thinking about to put in place, but as of yet, there's nothing down. But I would anticipate, yeah.
Yeah, I would anticipate we're going to do that
Yep.
once we have enough vaccine
Yes.
in order to deliver that. And at this point, we simply don't have that quantity. And you know, we just got a few doses. We won a few doses yesterday, and we expect another some coming in hopefully next week, and
Yeah.
likely from Moderna.
Yeah.
And then the week after that, maybe from more of the Pfizer. So we'll see. We don't know that full schedule yet, but we'll let you know when we do. And but I think I would anticipate we will have a question like that, just as we do for influenza. We don't have it yet. We don't have enough doses. Okay. The second part of that question, Taylor.
Will it change anything?
Yeah, for people that you know, have had to put off surgeries, that kind of thing. Now that hospital employees are starting to get the virus, does that change any expectations for them on when they should be able to schedule those kind of things, or what their timeline should look like for elective surgeries and such?
I think he meant to say that same.
Yeah. So I think the question for this is, does vaccination, will it affect the timing of other things we're doing? For example, we slowed down surgeries here at KU, and we've had to defer some surgeries, and we did that because we were concerned about the number of beds we have. Now, we've been able to keep our staff pretty heavily. We're actually staffing over our number of beds. And when I say that, you think, well, how can you have more staff than you have beds? The answer is we take beds that are normally used for another purpose and devote them to, in this case, COVID-19 patients or other admissions that come in. And so some of those examples include post-operative care areas, which would normally be there to handle post-op patients from surgery, or maybe even endoscopy beds or dialysis beds and things of that nature. And so that allows us to staff above our number of normally licensed beds. Now, we've been doing that, and we have to stretch staff. So I think it'll become easier to do those things as people get vaccinated and they don't get as sick from COVID-19. I think those things, that's a true statement. I think that'll be true throughout all hospitals. It will take a while to see that impact.
Yeah.
First of all, you have to get both shots. You have to get, the Pfizer one is 3 weeks apart, the Moderna one's 4 weeks apart, and then it takes 2 weeks after that to really begin to have full immunity. So really, we would be 6 weeks away, even from the impact of Marianne Copeland, our first person yesterday to be vaccinated. And so it's going to take a while to see that full effect. Yeah. And then we have to get everybody vaccinated, who are the frontline workers, et cetera. So I think that we are probably several months away from seeing an impact like that. The bigger impact, though, will be when patients and the people in the community are vaccinated, and there really are fewer admissions. We can get there even now before we're vaccinated if people will continue to follow the good rules of infection control. If our numbers keep dropping, and we haven't had this conversation yet, but if they keep dropping, one can anticipate here and at any other hospital in the city that you're going to start trying to open up those OR schedules back up again, because you won't be able to get those patients in. But the effect of the vaccine on that isn't true yet, though I fully believe that it will be. I think it's just going to take several months for us to realize that effect.
Yeah, absolutely.
Other questions? All right, I'm not hearing any, Jill. So let's think about our guest for today, and let's talk to Stacey. Stacey, how are you?
I'm good. Thank you.
Good. Stacey, say your last name before I mess it up.
It's Camuyu.
Okay, I would not have said that correctly. Camuyu. I'm just going to say Stacey.
Perfect.
Okay, you're from Great Bend. You had to be ventilated. That means put on a life support and taken by an air ambulance to Hays. Let's start at the beginning. When did you first think you had COVID?
October 31st, actually. Throughout the day, I just wasn't feeling quite right and a little achy. And that evening, I started running some fever. So over the next few days, I was at home trying to beat it on my own. Sometimes us healthcare people are the worst patients, right? I had really bad body aches and fever every day up to almost 103, and ended up on Wednesday starting with the cough. And by Friday evening, I was not being able to maintain my oxygen levels at home, and went to the emergency room and was admitted. And I was admitted, so technically on the 7th, and then by the 11th, I was put on a portable vent and flown via helicopter to Hays. So I was on a vent for 4 days, 4.5 basically, I guess. And then by the grace of God and a miracle for sure, I was off the vent by the 15th and home by the 19th.
That's remarkable because you're right. That is a really quick turnaround. So that's great. And then congratulations to the good folks out in Hays doing a great job of taking care of you.
They did.
So
Absolutely.
yeah. So what's the masking culture like where you are? And did you believe prior to this that COVID was real?
I did. I did believe that. I very much, being a nurse, I understand how viruses work and things like that. I have to say, I think I was a little bit misquoted saying that I thought they were unnecessary and useless. I did not think they were unnecessary and useless. However, here, in the Midwest, as you know, and especially in the smaller towns, I think that we just have a complacency because we know everybody. And I'm actually from Texas, and so I'm from the Dallas area where it's being taken very seriously, and I have family there. And I think that it's just that it's not going to happen to us kind of thing. And so I wore masks when I was in public most of the time, but not all the time. And I will say I even got lax about washing my hands and things. But it was sort of, I did it more just because, like, I don't know, is somebody going to, be upset with me because I'm not wearing one, and I involved in some of the political part of it, and just when you pay attention to that, sometimes it starts kind of infiltrating your thoughts, and I thought, well, I don't want to be forced to do things that don't make sense, and so I don't know, it was confusing, I think, to say it best, what to do exactly. So I was not consistent by any.
Are you more consistent now?
Oh, absolutely.
Yeah.
Yeah.
So now are you an apostle? Are you a mask apostle? Will you go out there? Are you preaching about masks and talking about masks all the time?
If you ask my kids that, they would say absolutely. Yeah, because I have 4 adult children, and then I have one still in high school, and we all kind of had that same attitude. And now I asked them, do it for people like me who had no idea I would end up on a ventilator. And, you just don't know. And the more that I'm researching and reading medical journals and I'm a member of a Facebook group for COVID survivors. And so we talk a lot about how it's affected us and is still affecting us, and how I will tell you, 95% of the people on there had no clue that they or their family member were going to be so ill. And that's what's scary about the virus, is the unknown, and just not knowing how it's going to affect you or your children. We know there's a higher risk for elderly, and I think that's where a focus has been a lot, but we forget that there are young people that are also dying from this. And one of the points that I have started making to people is they say, well, I don't have any, health issues. Well, it's the health issues you have that you don't know about that are scary.
Yeah,
So.
and you don't have to have health issues to get very sick with COVID. People think, well, if I don't have a health issue, I can't get sick. But the reality is, yeah, you can. Yes, you can. So what scared you the most? When did you know you were actually in a lot of trouble?
Well, I had an absolutely amazing respiratory therapist, Chastity, and at Great Bend, when I was still in Great Bend. And when she came in to me the morning of the 11th, I knew I was struggling. They had put me on a non-rebreather mask from the high flow cannula, and I kind of resisted because I knew once I was on that, it was getting more, I couldn't maintain. And she came in and she said, "Sweetie, we're gonna have to move you." And I knew. And when she said, I said, "So am I going ground?" And she said, "No, we've got the helicopter coming." And that was it. I knew we were in serious trouble, and I just, surrendered and knew that whatever it was going to take, I was going to do. So.
How important was it there to have somebody like Chastity? I think her last name is Chastity Thacker. Hopefully I said that correctly. To communicate with your family, communicate with you, and talk a little bit about how the healthcare staff helped you and your family during a time of such grave illness.
Oh my goodness. I can't, I've since spoken to Chastity, and I tell her I cannot put into words how important it was to me and my family, because when they came in and said that they were going to intubate me and send me out, she said, okay, now everything's going to start happening really fast. And I have my phone in my hand, and I have been trying to update my family and let them know, because they had to look for a bed for me, because they were short everywhere. And so when she came in and said that, I just handed her my phone, and we had a group message started with my family. And I said, could you please text my family and let them know what's going on and tell them I love them? And she did. I mean, when I came off the sedation, now off the vent, I was able to go back and read what she sent to my family. And my family, it would have gone from, I think they're going to send me to Hayes, to nothing for 4.5 days had she not done that, because I obviously wasn't communicating. They didn't know. She told them, because one of my daughters responded back and said, well, who's going to communicate to us then? How are we going to know what's going on? And she said, you call Hayes, they're going to give you a number, they'll give you updates. I mean, she just led them through that process. And it was just amazing. And when I got to Hayes, I had the most amazing people. And all the nurses were great, all the therapists were great. But there were some of those that just really stood out, because even though they were just so busy, and being a nurse, once I was off the ventilator and I was aware of what was going on, and I could hear alarms going off and, stuff like that, they still would take the time when they would come in. And we had a system actually that one of my nurses came up with, and I don't think I shared this before, but they gave me a whiteboard because after I was I was off the vent, I had no voice for 3 days. And so, I was just a whisper. And so when I started being able to communicate with my family via Zoom and things like that, I had to use a whiteboard to send the messages. Well, one of my nurses said, I tell you what, I'm going to give you this whiteboard. You push the nurse button. That was to my children there. My first Zoom with my family. So, but she said, okay, you push your button and write your question on your whiteboard, what you need. Because sometimes it was just, could you please call respiratory therapy? Because I needed a PRN treatment or something. And, of course, they have to put all their PPE on just to come into the room. So to save some of that, she came up with this where I would just hold up the sign that would say, can you call RT? And they would see it through the window, and they would go call RT for me. And it was only in things like that. Now, when I needed them, obviously, they were right that, they would come in and do what they needed to do. But it really helped streamline the communication for me, because I was a whole lot less severe than everybody else in the ICU at that point, because I was recovering. Yeah. And it's just amazing. One respiratory therapist in Hayes that knows Chastity, and they were communicating. She just kept telling me, Chastity wants you to know she's praying for you, and just amazing people.
Well, it sounds like wow. You had a great experience with healthcare, and being in healthcare, you know what that means. I know what our patients feel that it means, and having those connections to individuals really makes a difference. And I think Chastity may feel the same way about you. She wanted to share a special message with you. Let's take a listen.
Hi, Stacey. I just want to say I am so glad you are where you are at today. I know you know how much the odds are stacked against you, and myself and all those that took care of you are beyond grateful to have you as a success story during this difficult time. I want to thank you for your words of encouragement to us, and I also want to thank you for reminding all of us how important it is to keep our faith when everything seems like it's stacked against us. I can't wait until all of this is over and I can give you a hug in person. Keep on keeping on, and take care of yourself and your family.
That was amazing.
Make me cry, make Hawkinson cry, make you cry.
Here.
Well, thanks to Chastity and Stacey. My gosh, thanks to you.
Yeah.
You last question, you mentioned how wearing a mask and washing hands is about respect for others. Tell us Tell us more about that message now and how you share that with others.
Well, I mean, it started in my home. I have 6 grandchildren and under the age of 12, and they come over and now they walk in and they go straight to the bathroom to wash their hands and they count to 20 and just when I taught them about it, because they would say, my hands aren't dirty, and I say, well, here's the deal. If you give something on your hands to Nana, I could get very sick again. And you have to remember that when you're out, and that's why we're wearing masks, and that's why we're washing our hands, because you can pick those things up and you can take them to one of your loved ones or a friend or somebody you don't even know that may get very, very sick and may not even get to come home. And so it really has struck a chord with them. And like I said, my own kids that still live here in the house, and I think it's just teaching them respect, which I hate to say our country is really lacking as a whole, just respecting each other. And God gives us 2 commands: love me, love God before everything else, and love your neighbor. And I feel like wearing a mask and washing your hands is the washing the hands is for us more than anything, for yourself. But wearing that mask, it's just respecting other people, and just how awful I would feel if I exposed someone that didn't make it. And I realize, we don't always know who we expose. And I think the thing that people just don't understand is that you can pass this thing without even having symptoms. And that's what's so scary about it. But it's just respect. It's respect and love for each other. And if we could just get back to a world like that, I think a lot of things would be better.
Man, I couldn't have said it better in any circumstance. A mask says, I love you and I respect you. I like that. That is just true. Stacey, thank you so much for spending this time with us this morning. A special shout out to Chastity for the great work that she's done and her message, and to you and your family. Godspeed, good luck, continue the recovery. You feeling pretty good now?
I am. I struggle. This is not my pre-COVID voice, so I still have a little bit of a hoarseness, and I struggle with energy, which is pretty typical. But I have another chest X-ray this week to make sure that the inflammation has cleared up. I did have to do another round of steroids after I got home, but other than that, I am believing in complete healing, because that's what God promises us. So, yeah.
Best of luck on your road to recovery. I bet it continues, and sometimes it takes a while when you've been critically ill in the ICU like that. It can take 6 or 8 months to get all the way back, sometimes a year. It sounds like you're going pretty fast, though, so good luck, and again, Godspeed to you. Jill, let's see what questions we have out there from the community.
Well, we're going to get to those, but 8 reporters have hopped on the line, and we're going to start with Cody. He has a question.
All right. Hey, Cody.
Hey, good morning. And this question is for Stacey. First off, Stacey, thank you so much for sharing your story. We're so glad that you're okay and coming out of this. You mentioned very briefly complacency in the Midwest, especially in small towns. I mean, I grew up in a small town too. I get it. Tell us about that a bit more. And do you think that news of these vaccines being approved may make that worse in the short term, since it could be months before we're all vaccinated? What's your thinking on that? And what are you going to be telling people?
I'll be honest. I'm a very analytical person. I need reasons for things, and I need explanations. And I am processing the vaccine, and it's just because of media and what we hear about, all the things that are just bombarding us from, the vaccine's bad for you, or the reactions or things like that. I think that, how shall I say this? It really goes back to what I said. I think that if we could take politics and not worry about who's telling us what to do, and really think about what they're recommending, and use the intelligence that God has given us, that we would make better decisions. And I probably will get the vaccine. I want people that are more susceptible, obviously, to get it first, the healthcare workers and things that are on the front lines. I don't know if I'm answering your question. I think that there is a chance that it will give a false sense of security and that people will go back to being lax, but I don't know, because I know an awful lot of people that have experienced major loss in this last month or so, a couple months actually. And we have 2 friends that are still on ventilators, and one that passed away. And so it's hitting home now, I think, in this area. So I'm just praying that the fact that people are seeing more and knowing more people affected by the virus. Because we had 3 deaths in our county until right around when I got sick. That was it. And now we're up to 20 something, I think. I don't know. But so it just wasn't real to us. And I think it's become real. So I'm just praying that it's real to the point that people will start doing their part and, get their vaccine if they're comfortable with it and those kind of things. And I think it's going to take just more knowledge, more information, just like this kind of stuff being put out there about the vaccine for people to feel comfortable and that sort of stuff. I get my flu vaccine every year, and I spoke to my doctor. I'll probably start getting the pneumonia even though I'm younger, but because I've had the COVID and there's that risk of, my lungs not being good. So I believe in vaccines, absolutely. And I'm hoping that this does change that complacency, how people are being affected here.
Remember, Stacey, you just remind them that they have to have both good offense, the vaccine, but play great defense. Yep, that makes all the difference.
That analogy. So that was really great. I'm going to use that. I hope that's okay. So
It is yours. You just keep right on, keep on preaching.
I will.
All right. What else do we have out there? Okay.
All right. I do have a couple of community questions. One of them was Isaac wants to know from Stacey, do you think, and you kind of spoke to it, but do you think the mask wearing culture is any better or worse around Great Bend? Just your thoughts.
It's getting better. I do think it's getting better. And some of that is because the mandate, our county did adopt the mandate this time from the governor. And so I think that there are people that are rules followers and they're wearing them. I do still see people that don't. But like I said, I think that it's unfortunately, it's been a slow process getting here, but I have seen more of an increase lately. To be honest with you, I don't go out in public very much yet. And so, but even my husband, and my kids have noticed that, people are wearing more masks. But you still have people that don't. So, yeah.
Yeah, I think that I think that's true across most parts of our area, and I think that you're right. The mask mandates do help because there are rule followers, and once more people start doing it, you get a critical mass, and other people start doing it, and I think that's just, again, I'm a healthcare guy, and so I'm going to say that's the right thing to do. You want to keep businesses open, you want to keep our country open and thriving. Wear a mask because that keeps us healthy.
Lindsay with Channel 41 asked, how important is it to get the second dose right around 21 days? Why not just double the amount of the people who get at least a first dose and get them all a second dose as close as they can? Or
You bet. So, Hawkeye, that second dose is really important because it sets you up to get exposed twice to make sure your immune system is appropriately primed.
Yeah, that's the thing. That's the word that we've started to use more and more in this past week or so. Understand that the first dose is to prime. It's just a general concept, but you only get about 50 to 60% immunity from that first dose, or 60 or 50 or 60, and that's durable immunity to protect you. But it's really needed that you have the second dose, and that second dose comes 21 or 28 days after the first dose for the Moderna and Pfizer vaccines. You need that second dose. Only one dose has not been studied. Again, we don't know how long immunity will last with 2 doses, but we know that you are going to have a higher immune response and higher chance of not having disease, and especially severe disease, getting that second dose. So the second dose is extremely vital. And we understand, and we have been told, that the government is holding back those second doses so that if you did get a first dose, you will be able to get your second dose in that 21 or 28-day period.
Yeah, it's really important. I kind of think of it's like you're exercising your body's immune system. You can't just do it once. You got to keep at it.
Yeah.
And I think that it's really important.
Jeannie wants to know, she said, I think I've discovered that people with allergies should not get the vaccine. Is that true? Does that include all allergies or things like asthma?
No.
I second that. That's
Explain.
The medical.
That's the medical
answer.
term. No. You haven't really discovered that. There were some instances
Yes.
of people who have a very strong history of allergies, so strong they carry an EpiPen with them.
Yes.
That there were 2 patients in England who had some reaction and ended up having to, be attended to, and they may have had an EpiPen. We don't know all the details
Yeah.
around it. What we do know is that in both the Pfizer study and the Moderna study, this very question was specifically looked at. There was no difference in the number of allergic reactions between those who got the vaccine and those who got the placebo, Dana.
Yep, and there weren't any cases of anaphylaxis or allergic reaction. Those occurred after when those first 2 patients were getting it in the UK that we saw those stories about. Those are still being investigated to find out exactly what it was. I've been talking with Dr. Gear, one of our excellent immunologists and allergists here at the University of Kansas Health System, and it is certainly recommended that even with allergies, you get it. Now, we will monitor you for 15 or 20 minutes after your vaccine, but just having an allergy to food products or latex or anything, it is still recommended, and you are safe to get the vaccine.
And I would just say that when you start weighing this in your mind about whether you want to get it or not, and you start hearing this stuff out on the internet, it's kind of like some people said, well, it gives you 3 eyes, or it gives you, 4 arms. I mean, okay, those things are not true. And the question about allergies, just remember that thus far, between Pfizer and Moderna, together, 75,000 people throughout the world have had these vaccines, right? 75,000, not just 1 or 2, not 700, 75,000 people. In those studies, there just weren't serious adverse events. And we have to take that, and then we have to think about it. That's very similar to what we find with influenza. That's very similar to other vaccinations. So I think we have to be comfortable with this, and remember that you're weighing that against the risks of getting COVID-19 and dying.
Yeah.
So, there's no question on the scale of life where the excess weight is. The weight is over here on the COVID-19, saying that's a lot worse outcome than getting the vaccine. So it's not even close. So don't get deluded by people who may have another agenda, and don't believe the things you read on the internet. Believe the science. It's open and it's available to you. You can go read about it in the New England Journal of Medicine. You can go read it at the FDA website. You can read it from Pfizer. This is true. You are going to be safe.
Several people asking if employees at the health system will be required to get the vaccine.
We are not requiring people to do that. Now, we do require influenza, but we've had years of study with influenza, and we know that is something that is a fully FDA-approved drug, et cetera. This drug, or these vaccines, are an early use authorization. That means they've not been fully approved. You can say, okay, well, that makes me feel less safe. You know what? Okay, that's fair. The question, again, comes back to, are you safer with COVID, or are you safer with the vaccine? Clearly, you're safer with the vaccine. But because it's not been fully FDA approved, we don't have years of analyzing it, we're not going to require it of people, not yet. We're going to offer it to everyone. We are going to offer it to everyone, and I'm going to get it. Hawk?
I'm getting it. When it's my turn.
When it's our turn, we're going to get it.
When we get all of our
Me too.
important
I bet you're
respiratory
going to get it.
therapists
Yeah, all right.
vaccinated.
Michelle, I bet you're going to get it. So we're all going to get it, and because we want to be safe, and we want to keep our families safe, we want to keep our country and our society safe, we can keep each other safe. So we'll get it, but at this point, we're not going to require it. I suspect after the FDA fully approves this, that at some point we will require it, but not yet. But it's coming. It doesn't mean it's not safe. It just means that we're being fair to people and saying when it's fully approved, we'll talk about it, but right now it's an early use. We're not going to require it. We are going to recommend it. We are going to offer it, and we are going to encourage it.
Okay, Sean wants to know, is the immunity after recovering from COVID-19 stronger or less stronger than after you get the vaccine?
That's an awesome question. So in
Go for it.
those first, that phase 1 trial where they looking at, we'll talk about the Pfizer vaccine now. That first phase 1 trial where they were looking at safety of it, they were also looking at your amount of antibody response and your amount of T cell response, which is another cell in the immune system. And what they found was that you get actually higher antibody concentrations for longer than, say, people with mild or no symptoms who've actually recovered from COVID-19. So it seems that the immune response is much greater in this safe vaccine than it is even if you had COVID-19. So I think that's important to know as well.
For sure. And so, and now if you're more severe, you may have had a lot more antibody response. But for most people, that isn't going to be who they were. They're going to be the asymptomatic or the mild
Right.
folks.
For 80% of people who never need to seek medical attention, more than likely that research is speaking to you because you probably had not a severe disease, didn't need to go to the hospital, didn't really need to see your doctor. So your antibody levels, and they looked at convalescent plasma for this, so they were looking at antibody levels compared to the vaccine, and it was higher in the vaccine for a longer duration of time.
And Hawk, just to say, you're going to recommend the vaccine, and we're going to recommend it to people who've had COVID-19.
Absolutely. After having COVID-19, you are recommended to get it. Right now, some guidance says if you're acutely ill with COVID-19, don't give the vaccine. That's not really surprising. We know that if you're ill with other things, we don't really vaccinate otherwise. But if you've had it, and certainly if you are 2 or 3 months out, it will still be recommended that you get it. We don't know exactly what time period, say, can I wait 3 months or 2 months? You know, somewhere after that 8-week period is probably when it's going to be safe to get it. That also will help get more vaccine supply out to the people so that those other people who haven't had the infection can get it as well. And, you know, as far as the guidance in pregnancy and for people who are otherwise immunocompromised, say with chemotherapy or anything, there's really no contraindication. Speak with your medical providers. And if you are in those groups that it's offered to and you have those conditions, unless you have a contraindication to other vaccines, you can still get this vaccine as well. The biggest issue with immune-compromised people, say patients who are on chemotherapy, who have cancer, who have HIV/AIDS, is that really that the vaccine won't take because they don't have an immune system to generate a response.
Megan is worried about people who have sensitivity to eggs when it comes to the flu shot. Are people who are sensitive to eggs, should they worry about the COVID?
Not so much here.
No, not at all. You know, these are these vaccines are created in the laboratory. They are created by non-egg-based means in very, sterile medical lab type situations. But even in influenza, if you've had an egg allergy, more than likely you can still get any influenza vaccine out there. Although there is an egg-free version of it, in general, you can still get really any other type of influenza vaccine as well. So the egg allergy does not play a role here in these Moderna or Pfizer vaccines.
All right, Jill, time for 1 or 2 more questions.
Okay, 2.
Okay.
Josephine says, if I get both my COVID shots, can I take my mask off then?
Man, can't take your mask off until we make sure, Hawk, that the number and the prevalence of the society is lower, and a lot of people have had vaccinations.
Yeah, absolutely. Even after vaccine, even 2 weeks after that second dose, when we think you have your broadest amount, your strongest amount of immunity to COVID-19 after getting the vaccine, you still need to do those pillars of infection prevention. Wear the mask, not meet in large gatherings, not go out if you're ill, physically distance. Even Dr. Fauci has said, we probably won't be able to really go maskless until a year from now. So we need to get that out to the populations, the vaccines. We also need to understand what is going to be that full impact of the vaccines and our ability to get back to things like they were in 2019 and get away from things how they've been in 2020. So now, it's still recommended to do those things.
And part of the reason is we don't know yet if you can act, even though you are, the odds are overwhelming that you will not get as sick once you've had the vaccine, should you get COVID-19, but you can still spread it. And so if most people have gotten vaccination and say, well, gosh, I won't make anybody sick because we've all had the vaccine. But the real goal here is to eradicate COVID-19. So once we put a position for SARS-CoV-2 out there that everybody's been vaccinated, SARS will not have an easy chance jumping from person to person. The transmissibility, we hope, will decline, and people won't get as sick. So then the virus itself begins to die off. And I think that's where we want to go. We really want to beat COVID-19. We want to beat SARS-CoV-2. And it takes the mask plus the vaccine to do that.
Right, and I think there was some signal with the Moderna and the AstraZeneca vaccine that it did help reduce your ability to create and replicate the virus to transmit it to other people. But we also have to remember these vaccines really only start at vaccinating at 16 and above. So you still have that whole population of young people who we know have the same amount of virus in their upper respiratory tract and can transmit just as much as adults. So that's one other point to make as well.
Yeah, so we think that that's right. But remember what we said all along. You want to win the game, you got to play offense, you got to play defense. Don't stop playing defense just because you got the shot. Last question.
All right. Joanne gets the last question. She wants to know if the second dose is the same formula as the first dose, and can you mix and match?
Yeah, great. So the second question is there have been no mixed studies, and actually Dr. Alt and I were talking about this, one of our premier vaccine expert here at the health system. We were talking about this. There are no mixed studies, meaning mix one vaccine provider with the other vaccine provider. So right now, no mixing. So make sure that if you get it from one company, the second dose has to be with that second company as well, or with that same company as well. And then the first question was, what, Jill? It was.
Oh, is the second dose
it's
the same?
Yeah. So for the Pfizer product, it is 30 micrograms per dose. And for the Moderna, it is 100 micrograms per dose. But they're essentially the same vaccines. But again, make sure if you get one from one company for the first, it is that same company for the second.
And you're going to have some tracker to help you. You'll get a card or whatever so you can show the product. This is the one I had if I go to someplace to get my second dose. So, hey, so thank you all very much. I want to say a special shout out to Stacey, and that's a really big deal. Sharing messages for people like Stacey and Chastity is how our guests can believe that people can have the most impact in coming together as a community around mask wearing and vaccination. Tomorrow, we welcome the Kansas Leadership Center to learn more about a monumental effort to log 1,000 community meetings by December the 31st for a cause they call Beat the Virus Campaign. This is a powerful movement that you can join, and we're excited to have them join us. Stacey, final thoughts for today?
I just really appreciate the opportunity to tell my story, and that's what it is, God has written this story from my life, and I just pray that it will influence people positively, and that this campaign we have of keeping each other safe will continue to grow.
Well, Stacey, thank you. It is an inspiring story, and we appreciate that you had the courage to share it with everybody out there who are part of our audience and here with our team. It was a beautiful story. Thank you. Hawk?
Yeah, I don't think I could say anything better than Stacey said it,
No.
Wearing the mask, doing those things shows respect and love for yourself, but also respect and love for your community and your other citizens around you.
This morning the sun came up as it has every day since COVID-19 started. And as we go through these next few days, the sun will keep coming up, the sun's going to keep going down. There are some things that we can count on. They're a stable part of our lives. And the things that are stable around our life, they help to anchor us to the hope that we have for the future. The things that are most important are things like love, respect, friendship, community. Those things make us whole. We want more of it. We want to be together again. We can get there. But it takes a great offense and it takes a great defense. Because together, we can do anything. United we stand, and united we'll win. We'll be back tomorrow with you. We'll see you then.